Our project is on food insecurity in Canada. Food insecurity is an important public health concern as it currently affects 4.4 million Canadians, in which 1.2 million are children. This public health problem affects vulnerable populations the most, in particular Indigenous people. Food insecurity increases the risk of developing mental health conditions and chronic illnesses and affects educational attainment. Our group aimed to describe interventions that address food insecurity in healthcare settings and discuss general policy-based approaches for poverty prevention.
Why is food insecurity important? Food insecurity is a complex phenomenon that encompasses food availability, affordability, the cultural norms that dictate acceptable means of acquiring food or what food is commonly consumed, as well as individual food utilization. This multi-layered definition serves to highlight the different stakeholders implicated and the possible interventions that could not only involve the individual, but also the community and society as a whole. Given the diverse set of conditions that contribute to food insecurity, it is perhaps not surprising that it is associated with a diverse range of adverse outcomes. These include increased odds of mortality, which follows a dose-dependent effect, whereby the more severe food insecurity is, the higher the odds of mortality become. Food insecurity also increases odds of mental health disorders. The stress associated with being uncertain about food provision has been linked with adverse mental health effects, namely high rates of anxiety, depression, as well as inefficient coping mechanisms such as substance and alcohol use. Food insecurity also increases risks of hospitalization, reduces access to healthcare visits for adults, but most drastically for children, and leads to poor diet quality. Some studies also link food insecurity with early child growth faltering, obesity, poor physical health, low educational achievement, and development deficits in children.
To provide a comprehensive overview of our interventions, we developed a logical framework to help guide the synthesis of our findings. The framework essentially illustrates the conceptual links between the relevant interventions and the outcomes that they affect. As you can see in the figure, two types of interventions were identified. These were individual and household level interventions, which included food and referral-based programs, and preventive interventions, which included education and social investment. These ultimately connect to intermediates such as social determinants of food insecurity, like poverty, and proximal effects of food insecurity, such as impaired social dynamics, which can lead to mental illness. To identify the interventions for this project, we developed a simple search strategy. For gray literature, we searched the websites of Statistics Canada, the Canadian Institute for Health Information, and Health Canada using food insecurity as a keyword. For white literature, we primarily searched PubMed and Google Scholar. For instance, on the right, you can see that we use a simple two-concept search strategy with Boolean operators that included keywords for food insecurity and prevention.
There are several possible courses of action to resolve food insecurity, each with their own respective advantages. Notably, there are referral-based interventions which can connect food insecure people with social support. There are also food-based interventions. A 2018 study that evaluated meal delivery programs showed that meals that were medically tailored to participants' health needs resulted in over $200 in medical savings per person. There was also an intervention study on an incentive-based program in which physicians were given the opportunity to prescribe fruits and vegetables to low-income patients who suffer from chronic conditions such as diabetes. Results showed that patients had a significant decrease in hemoglobin A1C, which plays an important role in monitoring diabetic control. Ideally, however, to prevent food insecurity in the first place, we would want to address housing instability as well as poverty. The Canadian government has implemented targeted child benefit programs, which provide tax-free monthly payments to low-income families, and this has lifted 300,000 children out of poverty between 2015 and 2017. Moreover, increasing public school funding has also proven to be an effective structural change. Housing benefits have been estimated to reduce child poverty by up to 21%. Thus, by not only addressing the issue, but also by removing the root of the issue, food insecurity could be significantly reduced.
The evidence from the studies on food insecurity is strong, as the programs implemented, like the Child Canada Benefit, lifted 300,000 children out of poverty between 2015 and 2017. In addition, with the distribution of housing stipends, child poverty was estimated to be reduced by up to 21%. A limitation of the study is the lack of valid methodological foundations, including surveys that exclude data on household economics and sociopolitical environments. This makes their impact on households with food instability difficult to measure and extrapolate, as no targeted approach can be established and further renders the results incomparable across countries. Another study involving surveys demonstrated discrimination by failing to include populations living in higher risk of poverty, for example, First Nations living on reserves. A future direction for combating food insecurity is for food security programs to undergo in-depth and continuous surveillance of households with food insecurity in Canada using well-validated measurement tools combined with immediate policy changes. Lastly, future studies need to ensure their research is less discriminatory and more inclusive, especially that Indigenous populations, for example, are affected by food insecurity the most.
When developing interventions, there are some considerations that we must keep in mind. Some contextual limitations are people with unstable immigration status might be scared to apply for assistance, poor knowledge of community-based food resources like food vouchers, limited language proficiency, people in rural areas or with disabilities could lack transportation to grocery stores, and people who work irregular hours might not have the proper access to store hours. A cultural limitation is a lack of culturally preferred food, as food that were common in their home countries can be hard to find or more expensive. Lastly, a new ethical challenge during the pandemic is that there are people who are worried about getting COVID but lack personal protective equipment. Despite those considerations, some interventions, namely community food-based programs, have shown strong success in providing holistic support for those who suffer from food insecurity. The community food center models are government-funded projects implemented in communities to increase accessibility to affordable and healthy food. Currently, there are 8 centers across Canada, and they have talked to over 150,000 Canadians about their health, in which 66% said that they're eating more vegetables, 56% saw improved physical health, and 95% felt like they belong in a community. Community involvement in these centers can help build supportive environments to promote physical activity and empower Canadians to make healthier nutritional choices, while providing resources for accessible food.
My team and I decided on making recommendations to improve food vouchers because it is the intervention that has proven to be the most effective on the short and long term. First off, food vouchers are most of the time restricted to certain types of food, such as fruits and vegetables, but a study has demonstrated that this does not help their diet. So our first recommendation would be to distribute unrestricted food vouchers in order to preserve their right of choice. To promote healthy eating, Canada should put new policies to encourage dietitians to practice in the public health sector. Also, Canada has recently put in place the Local Food Infrastructure Fund, which aims at decreasing food insecurity, but the budget should be better structured in order to prioritize food vouchers. With increased funding in the food voucher sector, Canada could build new infrastructures such as markets with high quality food that would accept the use of food vouchers. Finally, we think that with all these actions, there could be a decrease in the prevalence of anxiety disorder and depression, which are highly linked to food insecurity. Also, there would be a cumulative incidence decrease in type 2 diabetes, obesity, and cardiovascular diseases because there would be a better eating in general. And finally, there would be a reduced emergency department visits and medical spending in diseases related to food insecurity.
There are many interventions aimed at relieving the burden of food insecurity. However, it is important to keep the larger issue of poverty in mind when pursuing any of these approaches. Due to the immensity of the problem, we require an intersectoral approach geared towards dismantling the underlying causes of poverty. And one of the ways that these interventions can be implemented is to reevaluate the budget of the Local Food Infrastructure Fund to include food vouchers and make room for other infrastructures to combat food insecurity. In order to get there, though, it's important that the public effectively communicates their concerns and demands, gains media attention, and meets with key policymakers, such as government officials and prominent public figures when given the opportunity. Besides lobbying the government, an equally important avenue is to lobby external organizations, such as the Professional Order of Dietitians of Quebec. They have the power to implement social policies as well as put pressure on the government. Provided that they offer their support, we can encourage them to mandate that more dietitians work in the public sector and provide advice on healthy and economic dieting to low-income and disadvantaged groups. To recapitulate, food insecurity is a significant problem affecting 4.4 million people throughout Canada. Of all the different types of interventions discussed, a combined approach consisting of food voucher and referral-based interventions would be ideal, as it provides disadvantaged groups with social support to combat the upstream determinants of health, as well as give them a means to acquire food with good nutritional value in order to relieve food insecurity's immediate effects. However, while there are effective interventions for improving outcomes at the individual level, higher-level changes such as budget reallocation and policy implementation need to be considered in order to counter the structural issues that disproportionately affect disadvantaged groups. It is only through hard work and advocacy that we can successfully protect people from food insecurity.